Lower back pain is a problem that affects nearly everyone at some point in their lives. Although the most common cause of lower back pain is muscle strains, it can also be caused by problems with the spine. One of these problems is the degeneration of the discs that function as cushions between the bones in our spine. When the discs degenerate, they can slip out of place and press on surrounding nerves, or they can become thinner over time and cause the bones in the spine to rub against each other. Surgery is often considered only when conservative treatment for these problems like physiotherapy and pain management fail. In the past, surgeons had to perform open surgery and make a big cut through the patient's skin and muscles to treat his or her spine. Now, they can perform similar procedures by making small cuts on the patient's back. Procedures like this are called minimally invasive spine surgery. Dr. Hawan Singh is an orthopedic surgeon who recently organized a workshop on one of the minimally invasive techniques in Pantai Hospital Kuala Lumpur. He says the procedure is gaining popularity among patients and doctors in Malaysia.
If you have a back problem and you cannot get enough rehabilitation, or is not successful for you, and if the medications don't work and you still have back pain, before going into something big and invasive such as a big surgery to put screws or to do disc replacements, you have the option of something minimalist like what we're doing with very small incisions.
Using X-ray images and also a thin camera as guides, doctors can insert instruments through the small cuts on the patient's back to perform procedures such as removing this material that is pressing on the nerve. Dr. Stefan Hellinger, an orthopedic surgeon from Munich, Germany, guided local surgeons on the technique. He says this procedure can be done under local anesthesia. However, he notes that like open surgery, minimally invasive surgery also carries the risks of injury to the nerves or spinal cord.
I prefer the term to say this procedure is minimal aggressive. And this leads to other advantages. Every surgery is like a trauma. After a trauma, you need time to recover. When I reduce a trauma, even done by a doctor, I can fasten the recovery, I can fasten the rehabilitation. At the end, I can fasten the return of the patient to his normal daily activities and to his expected quality of life.
Whether it's open surgery or minimally invasive surgery, surgery is only part of the treatment. Rehabilitation before and after the surgery is also crucial to help the patient recover.